I do that to say that my gut's clean, even though I have no worms. And then let's say the minimum you ask me to do is 10 sessions once a week. Or there's some people say once a month. And then maybe I stop after 6 months, and then after 1.5 years when worms start coming out, then you do it. And I understand. Once they start coming out, you do it till they stop. But what's the minimum sessions between now and 1.5 years? Because I don't know whether I have worms or not.
Absolutely.
So what's the minimum sessions that I need to do?
I would do 1 a week.
1 a week.
1 a week is a good start, because it cleanses and it infiltrates from your abdominal cavity into even the liver, the pancreas. All of these tissue is sitting there in a water that is cleaner, oxygenated, and with the herbs that stimulate for absorption, how the body is going to evacuate stuff. And once a week I repopulate gut flora. I have to repopulate gut flora. I can't just rip things out as if I'm having diarrhea every day. And we have to put friendly bacterium in. We even put friendly bacterium back in rectally. So people don't all want to go for fecal transplants. So we use things like sauerkraut, and we make it with extra brine. Homemade, not shop bought. Extra brine, and that water becomes my after enema injection. It's a tablespoon or 2, and we repopulate the colon with some friendly bacterium so that there's not inflammatory reaction because my colon is now flushed too often. So the colon and the enema protocol, we use it a lot because it's culturally something that people do. Like the yogis, I believe, here do saline enemas all the time. And every morning they start the day with that. You know, so it's not something that's unfamiliar. We're just adding something so that it can get that environment a little bit more clean. And because of the oxygenation that comes into the body from that liter, it also goes into the blood. So my whole body is flooded with what I have now injected through the uptake into the bloodstream as well, going where these other organisms are also delivering oxygen and supporting the evacuation of them as well.
Sakeena, could we just again go through the metrics of the protocol?
Hold on, I saw that you wanted to say something else.
Yeah, you keep using the word, you clean the water with the immunoclean. So what exactly do you mean clean the water?
Okay, so your interstitial fluid, right? When we have water in between and around and inside the cells. So when I take a liter of fluid into the colon, because it's porous and the intestinal tract is porous, that transfer through the colon actually enters into the interstitial fluid. Therefore, that cleans the water. I'm referring to the water of the body. Not the water of the water. No, this is a clean water when I start.
So now you clear that.
How long is the colon, how long is the enema held inside?
As long as the person can, up to 15 minutes.
I can hold it for 10 seconds. She holds it for half an hour.
I don't know the half an hour.
What is the ideal?
Ideal is between 10 and 15 minutes. But if somebody is toxic, they can't hold it, and you don't want them to hold it. Let it come out. They're going to come back and do another one another day. Rather than forcing them to hold it, and it gets so crampy and uncomfortable. The drawing of the water comes out when you actually evacuate into the toilet, and you actually also urinate more often when you have had an enema, for example. I haven't found that people feel that they urinate more when they drink it orally. Unless they just don't generally hydrate well. We do encourage getting it out by doing saunas or steam sessions, because people have a congested pathway out. Very few people sweat efficiently these days. So that is something we support with a protocol of sauna. It doesn't come naturally. When somebody doesn't have access to a sauna, which we don't have in Africa, there's no electricity and there's no sauna, there's no luxury like that. We take even plastic bags, put it around sheets, on the outside of the sheets, put the person inside the bed after they've had a hot bath or a hot shower, drink some hot tea, get the body hot, get into those sheets and make the body hot, and they sweat for half an hour. So that is to just evacuate out and make sure you keep on hydrating, because there's mineral changes as the body is evacuating. And the markers in blood that are loaded with, from cancer markers to your inflammatory markers, they are all coming down. We clean the blood with the coffee enema very effectively by cleaning the liver. We also have supporting kidney cleanses with parsley. Parsley tea is a fantastic kidney tonic that we utilize. in conjunction. You know, this is wonderful, and it goes on its own. When we've got luxury in our parsley as well, I'm going to get a quicker result even than just relying on that. I'm just mentioning that we utilize other little recipes as well for a further support, quicker result, because people don't have patience.
So you're telling me that I can use this for people with reduced kidney function?
Absolutely.
And you see changes?
Especially because it goes there first.
We had a gentleman with kidney cancer that it flabbergasted me, and I unfortunately I don't know what happened, but he was diagnosed with stage 3 kidney cancer, and he actually gave up his job because we advise people who have cancer not to fly whilst they are under treatment in any event, because most doctors say it's fine to fly, and everybody's flying here to India, and everybody's flying everywhere in the world with tissue which is integrity is not what it should be, and you get under the pressure of a plane where you get deep vein thrombosis warnings. But now that same tissue is under the same pressure when you have integrity of a tumor that is bursting in microbleeds into the system. So the flying can even spread cancer, and I saw that by accompanying a gentleman to Mexico many years ago. It's now about 17 years ago. When he was under a treatment in South Africa, we saw we did an 8-day treatment with him. He had a scan. We saw in the scan from the 8-day treatment bone cancer stage 4 clear within 8 days. They couldn't detect it. He flew to Mexico. When he landed, they immediately scanned him there, and they said, "Oh, why are you here? You shouldn't be here." As he left, because the treatment there was a 4-week treatment, as he left, they scanned him again, and it was everywhere. So the time from the flight, immediately as he stepped down, there was still everything happening. But over that period, a lot of things happened. So from that time, I started monitoring what happens to people when they fly. And within 2 weeks from the flight, when you are a stage 4 cancer patient, people crash. And yet when you are stage 1 or 2, your body has so much more resistance, so you don't notice that this squeezing internally has taken place. And you get a bit of a flu because the body wants to get the waste out. But people do not realize that there's been a pressure and an integrity loss in tissue internally, and you've actually spread cancers through the flying. But that's not general knowledge. That is still, we cannot publish it until we've done 15 years of research. We've just seen it in our own experience. It doesn't have to be long distance. We've had people have that experience from flying from Cape Town to Joburg, which is a 2-hour flight, from Joburg to Durban, which is an 1.5-hour flight, same thing. And cervical cancer I've had stage 3 cervical cancer reversed with this method. Again, lifestyle, cleaning from all avenues, continued cleaning the liver, because whatever's coming out is going to go to the liver as well, and we keep on cleaning the liver.
How long do you leave it up when you're...
Between 5 and 8 minutes.
Okay.
Yeah, so if a person is in a bath, I don't see a lot of baths in India, but
Sorry, a lot of?
baths.
Because
Bath
everybody
tub.
showers.
Oh, tap baths, okay,
So
sorry.
Yeah.
they lie on
There's
the
more
bed
shower.
and they put their wall.
I had it broth.
No, when they put their legs against the wall.
Yeah.
So this on their bed with the legs against
Okay.
the wall, and you put a pillow under the bottom,
Okay.
so it keeps.
Yeah, so it just keeps it in a little bit, and obviously some plastic, or if one doesn't have a unit that you can lie on to do it.
And I'm very interested because you said HPV.
Yeah.
There's a fair amount in Southeast Asia. I don't know how it is in India, but in Southeast Asia there's a fair amount.
Yeah.
And what are your results with HPV? Very
Very
good. Excellent.
All of what starts falling off with the men, things start dropping off.
There's a topical protocol as well for if a man has.
Genital warts.
Yeah.
Okay.
Yeah. Yeah. So even for masculine parts, it goes into a cup, and it gets soaked in that water and held in that water. Same as for a woman, 5 to 8 minutes. It goes into the cup of water that contains the medicine, so that we can clean from the outside whilst we're cleaning from the inside, always concurrently. Okay, spraying, wound spray. Because of an activation process, we use both bottles in any event, any time that we're not doing oral. So I'll have a little container, let's say that's my container, I activate, I have a wound the size of my palm. I'm going to activate between 5 and 10 drops, depending on how much pus, as per that other lady's leg there was. 5 to 10 drops into a little glass, activated. And then I add water. I love using saline water because it's just so much more soft on the system. And add the drops to it, and then I'm going to spray the entire solution until it's finished. Then I repeat that an hour later. Make a new batch, repeat spray. And the spraying can be used, we also have an eye, lots of people have infection in the eye, so we can actually make a very weak solution, 1 drop, and put just enough Ceylon water to keep the cup full, and then you would put it on your eye and hold it on the eye. And it cleanses the eye, even parasites in the eye. I have a gentleman now saying, oh, I got this thing crawling in my eye. I was like, okay, here's what we're going to do. So the multidimensional nature of the product is going to be applied by the wisdom of the practitioner with, okay, let's test this one there, or let's use this one there, because I haven't got another way now.
So, old lady in Kenya, so when I met her, I know that the lights are great. This cavity, this was completely gangrene. So we started the protocol, and I didn't do it. She only had one arm. She prepared the fluids every day because I was working. She said, look, just do it 3 times a day. So she just kept spraying this cavity, and I mean it's completely black. And this was closed with from the 2nd of December on the 22nd of December. That cavity for the first time in 4 years was closed. True story.
No, we take your word for it. You look very serious.
This was mastitis. This was mastitis on a Rottweiler. My brother in South Africa breeds with dogs. This dog had mastitis, on a gland, was completely ruptured. And we just gave it to the gardener, and we just kept spraying there, and we closed that cavity in 10 days just with the spraying protocol.
TB, lung cancer, flu, sinus, anything about these pathways, brain issues. We also do the spraying protocol for trouble in the brain, because you out of the spraying the inhalation, because it goes straight into the lungs and is straight into the blood, very bioavailable for the brain. The steaming protocol, 20 drops that we activate of each bottle into a little container whilst we're boiling the kettle. When the kettle is boiled, we'll put the hot water in the bowl, put the 20 drops that has now been activated into the water. If you have the luxury of some Vicks, is Vicks a thing in India?
It's everywhere.
Wonderful. Or menthol crystal, which is a bit sharp, but not
So
necessarily
just
readily
a little
available.
bit enough to
Open the bronchi.
smell and open the bronchi.
Okay.
So then we put a towel over the head like the mama and grandma used to teach us.
Yes.
And we sit nice and upright, not like this, closing the lungs, sitting nice and upright so that you can inhale properly to the lower lobes of the lungs as well. 3 to 8 minutes. 3 to 7 minutes. Let's make it 3 to 7 minutes. The indications on how to use it is on here. 3 to 7. 5 to 7 minutes. If there's a family and the whole family's got flu and there's kids, we put the smallest child on mama's lap. They sit by the bowl and the other kid sits on the other side, and they all breathe together. And we treat the whole family, because otherwise we reinfect each other as well, especially with the TB cases. So that steaming then is done consecutive days for no less than 8 days, because it grows back, and it's done twice, no more than 3 times a day on the steaming, because people can burn their lungs with the heat and cause inflammation again. So the caution of hot water is something one has to just remind people who have not steamed before, if one is not familiar with doing it. We have even used it in the steaming protocol for people who sit in the sauna, and you just activate it into a little bowl and put some hot water in, and that sits in the sauna with them. So the air that is in the room or in the sauna room is actually with that, and they can inhale it at the same time. So there's a different application of steaming. That doesn't mean sitting over a bowl.
Yeah.
That's just an extra as well. In terms of transdermal,
This is now for cancer.
this is a specialty protocol because it comes with DMSO, unless we use it with castor oil if people have access to it. Because DMSO is a scheduled product and it can go horribly wrong. We don't work with plastic at all, except for this HDPE plastic, which is what DMSO is packaged in their big drums. As the only carrier container that does not get leached out by the DMSO. So a phenomenal medicine. And the protocol for that and how we do, and people with MS, we do also treat people with nervous system disorders with the DMSO transdermal protocol, because it has such great results through running, because it runs through the nervous system. And it's running just under its boiling point, our body temperature at 37.5, 37, is running under its boiling point, which is 40 degrees. Which reaches, if you worked with DMSO before, you'll know, but if you're not, if you put DMSO on your toe, you'll taste it within 10 to 15 seconds, because that's the rate at which it's running through. Or you taste a little bit of garlic. It's like a garlic flavor at the side and back of the tongue where you will taste it. Although in all of our protocols over all of these years, people have been treated at home. People have been treating themselves at home. Our program has been designed for people who can't go to facilities. It's for the forgotten people. So we educate people. How do you use it? There's so many ways. And the majority of the marketeers in the world that we have passed have said you can't have one thing that does so many things. We said we have one thing that the whole family can use. Mama's got flu, this one's got that, this one's got a wound, everybody can use it. Which is not something the marketing world wants to hear.
So the big danger on DMSO or the OCC protocol, OCC means overnight cancer cure.
It's an international recognized design protocol, not our name. We didn't give it that. That is what goes with DMSO in terms of how the protocol is worked out. Overnight cancer cure, just because you prepare your body overnight for the actual treatment, which means that on day one, I'm going to show or talk about the how to mix in a moment. Day one, you're going to treat the body 4 times, and we start mid-late afternoon, say 3 o'clock, 4 o'clock, 5 o'clock, 6 o'clock. Every time we do an application, let's talk about it quickly. I will use 20 drops of both, activate it. Now it's a bright color. After the 3 minutes of activation, I add a teaspoon of DMSO and mix it. Give it another.
A metal
Hang on, you add 3 drops first?
20.
20 drops.
20.
Okay, from both, okay.
From both.
Okay.
Can I do it? Does anybody want some?
Yes.
Oh, people are scared.
Yeah.
Let me do it. I'm always happy to have some DMSO and immunotherapy. I've used it so much, I just squirt because I know how much it must be.
Now you wait 3 minutes for it to marry.
Okay.
And once it's married, you'll see the color changes and you actually start seeing a medicine forming. It goes yellow, it goes brown.
So you see changing color, okay.
Changing color.
Okay.
And now it smells like a jacuzzi.
Okay, so whilst it's activating, 3 minutes always in glass, only using stainless steel rather than plastic ever because of the leaching of the plastics. So once it's activated, I just want to give it a moment that it can properly activate. Then we add a teaspoon of the DMSO. This must now marry that.
Okay.
So we give it another 3 minutes. This is a little ritual, it's a
Okay.
ceremony.
So 3 minutes, okay.
3 minutes. Once that is ready with I'm in a hurry, with my 3 minutes and my DMSO added, I'm going to apply it onto the body. But I can't just do the same place each time. So I start, for me, in my personal advice to people, I start on the torso from here to the hips. Because there's so much that is in this whole torso of ours. So I apply it all over the body, painting it.
Only on hard tissue, not on under the arm or on the neck. It will itch within a minute.
Or
On
the private parts.
Area, it is
Very thin skin, right?
Okay.
Yeah, the skin is sensitive, much more sensitive. So the next step is a little bit of DMSO. There's an immediate reaction with the DMSO, which makes, because the medicine is in it and oxidation is being carried, dimethyl sulfoxide to methyl bonds methylation.
Yes.
Is how our liver is getting
Yeah,
out sulfation, gets things out. So the application is like a paintbrush, but you don't use a paintbrush, you use your hands. And I'm going to just get it out of the bowl onto me. Okay, then as I apply, I just want to get the bowl empty. I'm just using here, but the body, the torso for me is the first place to go. It can go anywhere on the body, everywhere where there's
It's
skin.
going to be applied 4 times the first day. So you use one the first hour on this arm, next hour on
So
that
we
arm.
do different parts of the body. First one here. If there's somebody for the back application who has no nail polish on, we can do an application on the back as the next one. Now I've covered the torso on my day with a fork. The next one I can put on the front of the legs. The next one, because you make a new batch each time, 20 drops, and I apply it onto the bottom of the
4
legs.
times a day.
4 times.
The
How
first
many?
day. The
First
first
day.
day.
Second day, the first day you apply 80 drops. The second day you apply 240 drops.
10 times.
So
3
you're
times,
13,
okay.
yeah,
13 times every
13
hour.
times.
3 times, yeah.
So you do it every hour, but
So it's only 2 days then. Sorry.
Wait, no,
Not
I'm getting there.
Yeah.
Day 1, 4. Day 2, 13. Now I can't go here and then there and then back here. We want to give it a 4-hour time between applications to the same place because I'm drawing medicine through there. So I want to give the skin a rest. So on the 13-hour day, there's a little roster that we give. You start with the torso, the front of the legs, the back of the legs, the back, the arms. 4 hours have passed because I'm doing it hourly. I can come back to the front, back, upper, arms. And by the 13th time, I've done another one on the front on the torso, and I'll do another one on the back if we are at that time of the day.
Okay,
So
what
we go
is
in
that?
a little bit of a rotation. So you apply it on 3 days, 1 day 4, day 2 13, day 3 we rest, nothing onto the skin. We drink, we enema, we do all the other things. But the resting day is to give the immune system a chance to get out what this activation has now created. Then we start again, 4, 13, rest. 4, 13, I'm on day 8,
That's why it's 8 days.
rest. And then depending on the stage of the cancer, if it's a stage 4, I can't stop after 8 days. There's blood still coming out. Then we go to what we call the mini OCC. Then it's 4 a day, 2 days on, 1 day off. 2 days on, 1 day off. 2 days on, 1 day
Until
off.
it's all
We keep
finished.
on cleaning it out.
Until the 2 bottles are finished.
So what
The
is it?
next step though, I have now put it on. I want to get it all on actually because I would never want
Because
to waste it.
usually the time that you use, your estimate time, it stays on the body for 3 minutes. The first time it's okay, but if you do 13 hours,
You know all about it.
but knowing that it boils at 40, when it starts itching, it's not itching, it's itching because you are busy cauterizing and you're busy burning off the top layer of your epidermis.
With the 40-degree DMSO activation.
So it's important to
you
wipe
wipe
it.
it off after 3 minutes. So the whole treatment takes 9 minutes. 3 minutes to activate the one, I beg your pardon, 12 minutes. 3 minutes to activate one, 3 minutes to activate the second with the DMSO, 3 minutes to apply it. Then after 3 minutes I wipe it and I'm done. An hour later I do it again. Okay, and that's the rhythm. When we go to the mini OCC, I must just say, and you have to wipe it. So I'm going to go wipe it just now. Otherwise, the skin gets irritated.
Dr. Sakeena, could you just tell the audience in which case do you use this method of application, not just for cancer?
Dreaded
Cancer,
disease, any dreaded disease
When
that
you
you
can't
fear.
go through the veins, when you can't get near people in other ways, this is
Or
through
a
the
severe
skin.
infection, say you've got COVID now,
Yeah.
just COVID or Ebola,
Yeah.
or
Yeah, MS, nervous system diseases, people who are.
So if you can't apply yourself, you're really weak. Somebody can do it for
So-
you.
Absolutely, they'll get the same benefit.
Always somebody must apply.
Because the
That's why
hands
with a
are-
doctor,
Yeah.
your nurse will do it for. That is where you make your money because the nurses do the job and it's got a fee to it. So
And we don't just use 11 or 19 drops, we use 20. Make sure the bowl is dry. And if you have certain cases and you can send us a message and say, okay, how would you do this one? Because there's different applications that you'll still get into the swing of what to do, and we'll give you the guidance along the way.
Thank you.
Yeah.
So it
Thank you for
activates
your
your
attention.
mitochondrial energy chain.
Absolutely.
So
Now remember, cancer is the mitochondrial dysfunction.
Yes.
And we go through the water to get the mitochondria started up again and get the oxidation going again. Even just oral. The liver support with the enema is with coffee. And we also even put the immunoclean in the coffee, always adding salt because the saline requirement of the electricity,
So-
supplying minerals is important.
So for kidney failure, what is the protocol? This is the one oral.
We drink
one?
it very
Oral,
much, very
yeah.
successful because with the drinking it's going straight and gently into the blood.
Right.
And I had a reversal of kidney cancer within 30 days of drinking only. If you have the luxury of, but it's not necessarily for everybody, this person was very committed and changed and did all the nutritional changes that was also burdening the system. When you have the luxury of transdermal, it's a bonus because you're going to get a lot more in and do a lot more, a lot faster. Combining it with the enema, just the saline and immunoclean enema rather than just oral, you are going to soak the kidneys here by doing the enema. That in itself will also help. But then we do supportive protocols like parsley tea and good nutrition, breathing, etc., sweating. because the kidneys are very much supported through heat. I find in India a lot of fatty kidney because women have their kidneys open and exposed to the heat, and because of the exposure, now we've got to form fat to protect and warm the kidney a little bit. Consequent to which, if I bring heat to the kidney, the capillaries can open and flow can start happening again. Congestion can be released. And the cardiovascular improvement for people who do regular saunas go down, that your heart disease risk goes down by 60% with regular sauna. Infrared is fantastic. But even there, you can actually put it at the feet of the patient in that it's actually safe and clean, not cosmetics, not facial creams, all these things that have names you can't pronounce. We stick to even olive oil. You can put onto the skin and just soothe it and hydrate it.